things that I want adults to look for. One is typical teenage emotions are all over the map. Kids are high and low all day. It only becomes worrisome if they go to a dark or concerning place and stay there. Mm-hmm. We do not expect teenagers to be down for 24 hours in a row. That's a very long time in the life of a teenager. 36 hours is very long. Or paralyzed by anxiety, or beastly awful to live with. So if your kid is pushing 24, 36 hours, or it's shorter than that and you just have a very bad feeling, go get help for your kid. That we expect mood to fluctuate. We don't expect it to get stuck in scary places. The other thing to look for is what I call costly coping. So they're coping, but they're doing it by smoking a ton of weed, or they're coping by self-harm, or they're coping by, stirring up endless drama on social media as a way to distract themselves from their pain. Mm-hmm. If the way they're coping has a real price tag attached to it, go get them help.
And what are some of the ways that parents can seek effective help? I mean, I will tell you, as a primary care physician, we're doing 80 to 90% of the mental health in this country. And even in my medical practice experience, especially being in a community setting, in a community clinic at the time, it was very hard. Yep. This is why we're doing so much of the mental. It's very hard to get mental health, even when families can afford it. So what are some thoughts?
Well, this is true. And it's not good. I mean, I'm not going to sugarcoat this. And it's interesting because, there's been so much talk, as there should be, about the adolescent mental health crisis. But it's a two-part thing. We only talk about one part. So one part of the crisis is we had this huge surge in distress. It was rising, and then the pandemic took it to all new levels. Yeah. The other part of the crisis is it was hard to find a clinician for a teenager before all of this. Yeah. And taking care of teenagers clinically is very specialized work. Not everyone wants to do it. And even if you're into it, it takes a long time to get trained to be good at it. So when we had this huge surge in need, it's not like we could sort of magically triple the population of clinicians who were equipped to handle the work. And so those two things together have deepened a crisis that was already underway prior to the pandemic of trying to find care for kids. I mean, that's a real issue. Mm-hmm. So here's what I would say. Talk to your pediatrician. They often know who the local talent is. They know your kid. They can often make a good match. Get on waiting lists. Take the waiting lists. There are also some things that do lend themselves to home care. Anxiety and its treatment can be quite paint by numbers. There's very good books on the management of anxiety. Obviously, depression, especially if it's emergent, like you're going to get your kid help. You may have to go through the ER, which is terrifying for everybody, but if you need to do it, you got to do it. I will also tell you, my Ask Lisa podcast isn't the answer, but it's an attempt at an answer. We are, Rena, my phenomenal co-host, and I we're well past 150 episodes. Every episode answers a question from a parent. Every episode is just about half an hour long, if shorter. And so that has been our effort to democratize mental health care for families. It's all questions about teenagers, and it's all what to do, how to help. The last thing I will say, if you are stuck on a waiting list, which you may be, do not underestimate the power of the basics. Make sure your kid is getting enough sleep. Make sure your kid is getting high quality nutrition. Make sure that your kid is physically active. Have your kid, if you can, be busy with purposeful activities. My view of what constitutes a therapeutic interaction for teenagers is very wide, not because it has to be, because this is what I've learned. Some kids are going to benefit from therapy. Other kids are actually going to be surprisingly improved by getting a job where they feel good about themselves and they're making money, or going to a theater program where the adult running it gets kids, connects with kids, supports kids. It doesn't always have to be a clinician in an office to help kids get better. Now, of course, there's some kids where they need and deserve nothing but clinical care, no question. But the basics help, connections help, feeling counted on in some meaningful way helps kids. And so those are some of the things adults can do, especially if they can't find the clinician they're looking for right away.